I'm going to be demonstrating the use of the ultrasound. So today is going to be a patient with chronic pain. So we're going to be using thermal ultrasound today. So indications include pain modulation, increasing blood flow, reduction of muscle spasm, and increasing the sensibility of collagen. So contraindications. She was previously pregnant twice, so for her it's going to be pregnancy, decreased sensation and circulation of the area, vascular inefficiency are going to be the main indications for this patient today. How's it going, Eric? So I'm Dean, your student physical therapist today. So today we're going to be doing some thermal ultrasound on your low back because I understand you're having some pain in that area. So before we do any kind of treatment, I want to ask you, are you currently pregnant?
No.
Do you have any decreased sensation or circulation in that area of your low back?
No.
Okay, perfect. Do you have any thrombosis, any malignancy in that area?
No.
Perfect. Okay, and it's going to require me to lift up your shirt and then your shorts slightly so I can put the gel in that area and move the wand around. Would that be okay with you?
Yes.
Okay, so I'm going to roll up the shirt so I can get the low back on the right side. Perfect. Okay, so now I'm going to be showing the machine. So I'll go ahead and turn it on. Okay, so I'll be pressing sound for ultrasound. And then because it is deep in the low back, I'm going to keep it at 1 megahertz. Time is normally going to be 5 to 10 minutes. And then because we're doing thermal, we're going to do 100% duty cycle. So I'm just going to keep it on that continuous. Intensity is going to be from 1.5 to 2 watts per centimeter squared. So I'm going to just put that at 1. And then based on how the patient kind of responds to the treatment, we can adjust it from there. And then we want to have the effective radiated area around 2 to 3 times the area of the treatment site or of the low back that she's feeling it. Okay. All right. So I'm gonna have this ultrasound gel. All right, I'm gonna put some ultrasound gel on the low back where you're feeling it. It's gonna feel cold, okay?
Okay.
Right. Okay. And then what I want to do with the ultrasound is I want to put the head of the wand on the body before I get started and prior to ending. So I'm going to go ahead and place the head on this low back, and I'm going to start the treatment, and then I'm going to start the machine. Alright, Eric, just let me know if you ever feel any kind of dull aching or any uncomfortable sensation. And then from there, I'll kind of move it a little bit more around or like reduce the intensity, okay?
Okay.
And the big thing I want to do is I don't want to remove the head of the wand off of his back. I want to always make contact. How's that feeling?
It's good.
Good. Okay, and then I'm going to go ahead and stop. And then I'm going to get a towel. I'm going to wipe off the gel. And then I'm going to inspect his skin to see if there's any redness, any irritation that occurred from doing the ultrasound. Okay. Okay, so there's no signs of irritation or inflammation that occurred from the ultrasound, so it looks like there was no problem with it. All right, Eric, so that completes our ultrasound treatment for you today. Did you have any questions for me?
No.
Good, and how did it feel for you?
Felt good.
Perfect.